Well, good morning, everyone, and thank you for joining us for our research day of the Methodist DeBakey Heart and Vascular Center. This is a special day, I think. This is our first day dedicated for our collective research. And we're talking about Heart and Vascular Center, which is, I think from a research perspective, is the largest in our institution. So we're very proud of that. And as you will see, quite productive. And we have quite a few posters. We'll talk a little bit about that you will be presenting. And hopefully, we'll have amazing competition there, first prizes, etc. But let me tell you why we're doing this. We thought about it last year. The chairs of CB surgery, cardiovascular sciences, and myself, is that we go to meetings, we present posters, we are on the podium, etc., but not too many people see collectively what you do. Particularly, you are in the same institution, and there are so many opportunities for collaboration. I'm talking about clinical, talking between clinical and the basic sciences and our neighboring institutions, Rice, University of Houston, and all the other institutions basically in the medical center.
You said that.
So it would be nice to have half a day where we share as to what our vision is, what are currently the areas of interest, and you will hear that from our chairs as to what could be done, how can we optimize research, spend quite a bit of time talking about it and visiting, the posters that you have here. So first, I want to thank our staff to put this together because it is not a small undertaking. First, I want to thank Casey Kappenman. Casey, I think, is outside, and all of you know he's our director of the senior administrator for research in the Heart and Vascular Center, and also Chris Ibarra. These are two individuals with many of the other staff that help put this together today. The agenda is quite extensive for a short period of time and hopefully interesting to you because we will have an overview of the Research Institute and its direction by Dr. Sussman. We'll talk a little bit about the RB and some of the new things that are going on in the RB to facilitate your research. You'll get an overview of the chairs as to what are the areas of research that they're working on and some of the accolades that they've received. Then we'll spend an hour and a half after the break going through the posters. I want you to interact as much as possible with the poster presenters and quiz them. And during that time, we will choose our winners, if you will. Then we'll have two opportunities for collaboration with panel discussions, one for clinical and the other one for basic sciences and the clinical, and how do we pair this? And we should be able to leave probably 12:30 or almost at most 1 o'clock. So a condensed agenda, but I hope meaningful to you because you're going to get to meet so many people who are doing research. All the leaders are here, so you can ask them about direction and how we can help you. Importantly is this is for collaboration to see what your colleagues are doing in the same institution. People ask about how did we choose the abstracts? Interestingly enough, we had about 110 abstracts submitted. We have only posters for 50. Maybe next year we can grow them a little bit, but I think it's good to have selection. So all these were graded, selected, etc. So we selected 50 out of the 110. And you will see an amazing array of interest and a variety of topics that will be there. All right, so without further ado, we're going to ask Dr. Sussman to give us an introduction as to where the Research Institute is and what is the direction, with some emphasis, obviously, on heart and vascular. Dr. Sussman is out of town, so we asked him to record this for us And
Good morning.
if you don't
I'm
mind,
Dirk
can you play
Sostman, the President and
video
CEO
for
of the
Dr.
Houston
Sostman?
Methodist Academic Institute. Dr. Zogby asked me to welcome you and give you a little background and context about the research programs in Houston Methodist more broadly that will help to anchor the activities of Methodist DeBakey Heart and Vascular Center's Research Day. I'm delighted to do that. Unfortunately, I'm on travel, so I can't be with you in person, and I'm really sorry to miss this day. But let's go ahead and look at what Houston Methodist more broadly has been doing in research over the last few years, and what the plans are for the next several years, which I think are very exciting and very much concordant with the Heart Center's vision and plans for its evolution. So let's look at what's been going on. Our research evolution has been guided by a strategic plan that began in 2012 and has been continually updated, but following the same principles, continuing along the 5 key themes of clinical research, innovative education, restorative medicine, precision therapeutics, and outcomes research. Paying attention to connecting the academic and clinical missions, working primarily through the lens of our centers of excellence, capitalizing on key platform technologies, and trying very hard to connect with Houston Methodist Hospital's innovation initiative. So, quick review of what the centers of excellence have been doing. Neurorestoration, work with rice, work with cell therapeutics, developing a T32 training grant. Orthopedics, working on the Human Performance Center and recruiting a translational research vice chair and building up that translational research program. The Cancer Center continuing to work on its path towards NCI designation. The Heart and Vascular Center, we'll talk about in a few minutes, working on cardiovascular wellness, cardiovascular restoration, educational programs, and new devices and first in man. GI, working on the Food and Health Alliance and the Inflammation Collaborative. Transplant, working on organ restoration and rejuvenation. And a new Center of Excellence in development in infectious diseases. And then some of the platform technologies like cellular therapeutics. Big lab opened in 2022. RNA therapeutics continues to develop and expand. The development of our Houston Methodist data repository for big data and artificial intelligence work. Continuing to try to modernize the clinical trials infrastructure. Investing in clinician scholars. Since 2019, when this program was launched, 22 clinician scholars have been funded with over $12 million of Houston Methodist support, resulting in them receiving over $14 million of external grant funding. A very competitive and, I think, very important program for our future. And then, of course, innovative education programs, including the PhD programs with Weill Cornell, the collaboration with NMED, the T32 training grants, and the relaunch of the Mighty program, resulting in record new grant awards, last year being the first $100 million plus year for research grants, record commercialization revenue, record publication volumes, which have grown 60% since 2019. Amazing development of philanthropy. And of course, in parallel with that, continued growth in the support from the Houston Methodist system for research programs, for which I think we should all be very, very pleased and grateful. The good news is that although our research space is pretty much tapped out now, we've been able to get 28,000 gross square feet per floor of 2 floors, so approximately 78,000 gross, about 56,000 assignable square feet in a beautiful new building in Helix Park. Occupancy being the first quarter of 2025. Research programs including cardiovascular science, RNA therapeutics, orthopedics, and some programs from the Department of Medicine will be occupying this amazing new space. And in parallel with this, we've been growing institutional partnerships. While at Cornell, we have a beautiful clinical research training program, as well as the graduate school programs, Texas A&M, NMed, the Cancer Center programs, MD PhD students, and medical student rotations. With Rice, 2 joint centers for neural systems restoration and human performance. Some very exciting pilot projects that we're jointly funding with Rice, and a couple of other initiatives, including digital health, that are in the planning stages. And then our newest affiliation, University of Texas Medical Branch. They've been critical partners in our obtaining grants from the Coalition for Epidemic Preparedness, and we are on the cusp of submitting a CTSA collaboration with them. So what has the DeBakey Heart and Vascular Center been doing during this period? And you can see some of the key players in this diagram. And over the last 5 years, the Heart and Vascular Center has been at the forefront of bringing next-generation technology to Houston Methodist. Pharmaceuticals, devices, biologics, work in heart failure, electrophysiology, vascular disease, imaging, and critically important interventional technologies, spanning the gamut from first-in-human to phase 4 clinical trials. And over the past few years, a dramatic development of cardiovascular disease prevention, wellness, population health has been really tremendous. And then, of course, the continued national leadership of the Heart and Vascular Center in cardiovascular education. Basic research in the Heart and Vascular Center and some of the national prominence has also continued. Cardiovascular sciences having received over $9 million in external funding, very high impact publications, and tip of the hat to Dr. Valderrabino for a really dramatic progress in clinical science. So what's next? Over the next 5 years, we're continuing to evolve the overall strategic plan. If you look at the different phases of Houston Methodist's academic trajectory, this is going to be our time to really cement our national impact, working in research and quality, developing a critical mass of academic programs, continuing to expand our affiliations, working on selected national impact programs, as well as continuing to evolve the strategic plan, and really cementing that position of Houston Methodist as the academic medical center of the Third Coast. So continuing the strategic plan, all the centers of excellence have really wonderful ideas and plans for the further evolution of their programs. As well, the shared platform technologies are continuing to evolve, and new national impact initiatives in quality, innovation research, robotics, health span and longevity, translational impact enhancements, immunotherapeutics, gene editing, and more are all on the drawing board. And as with the last phase of the plan, the Heart and Vascular Center is there at the forefront, including next-generation technology in vascular biology and computational research, IITs, again, spanning that clinical trials continuum throughout the phases, expanding the wellness prevention, exposomics, women's cardiovascular health, expanding the registries and analytics, getting digital health and artificial intelligence, continuing the national leadership in cardiovascular education, the national training sites, the GME research fellowships, obtaining a T32 training grant, really prioritizing driving NIH funding and driving clinical trial performance. All that adds up to what we feature on our website, Pioneering a Brighter Future for Medicine. That's the difference between practicing medicine and leading it. So that remarkable development of research programs over the last several years at Houston Methodist is the context in which you begin this research day. I compliment the Heart and Vascular Center on your achievements to date, and I look forward to applauding your achievements that will happen over the next 5 years. I wish I could be with you today, but I know you're going to have a great and exciting day today. So all the best.